Hello everyone, today we're going to be covering chronic bronchitis in under 3 minutes. So, chronic bronchitis, it is defined as a condition where there is persistent cough with sputum for at least 3 months and for at least 2 consecutive years without any known cause. So, it is a clinical condition where there is a cough continuously for at least 3 months and for at least 2 consecutive years without any known etiology. So, what are the predisposing factors of chronic bronchitis? That is your chronic smokers, tobacco smoking, and acquired CFTR dysfunction. So basically, CFTR is cystic fibrosis transmembrane regulator dysfunction. That if this protein has any hamperment, then your mucus can be dehydrated and abnormal. So let us know about the pathogenesis of chronic bronchitis. So first, when you inhale the toxic or noxious substances such as all this which is listed over here, so that can damage your respiratory epithelium. Then basically that causes injury to the lung, so you get an inflammatory response. Inflammatory response causes secretion of some immune mediators, and then it basically leads to two response. In the bigger airways like trachea and bronchi, it increases the size of the submucosal glands, and therefore it increases mucus. So this mucus causes dyspnea on exertion. And when you have acquired CFTR dysfunction, it can, as I said, it can cause abnormal dehydrated mucus and it increases the inflammation state. Now here in the smaller airways, it increases the goblet cells, and that increases the mucus production, as well as it increases the fibrosis of alveolar walls. So that will narrow down your alveolar lumen, and then it will lead to something known as bronchiolitis obliterans, means complete obliteration of the alveolar passage. So you might face breathlessness. Okay, coming to the morphology of chronic bronchitis. So basically there is hyperemia, swelling and edema of lungs, and the mucous membrane. In microscopy, excessive mucopurulent secretions, pus-filled bronchi and bronchioles, thickened bronchiolar wall, and you'll get smooth muscle hypertrophy and hypertrophy of submucosal glands, as we already said. And then there's something known as Reed's index, which will increase. So Reed's index is basically the AB by CD. Now what is AB? AB is the total thickness and CD is the thickness of the submucosal glands totally. Okay, now in the bronchial epithelium, you might get a squamous metaplasia that may be predisposed to cancer. And these are the clinical features of chronic bronchitis. Thank you so much for watching. Follow for more updates.